Good day and welcome to 4HT Health. In today's lesson we are going to talk about gateway drugs. Gateway drugs refer to legal drugs that a non-drug user might try which can lead her to try more dangerous drugs. In gateway drugs, it does not pertain only to drugs or medicine. Like what you see in the illustration, alcoholic beverages and cigarettes are considered gateway drugs. Cigarettes. Smoking is a practice wherein a substance is burned and the resulting smoke is inhaled and exhaled by the user. The most commonly used substance is the dried leaves of a tobacco plant, which is rolled into a piece of a special paper, e.g., rice paper, to create a small, round cylinder called cigarette. Cigarettes when burned release thousands of chemicals that is harmful to the human body. These chemicals include carcinogens, poison, etc. that are harmful to your health. Alcohol or alcoholic beverages. Alcohol is a colorless, bitter-tasting liquid that is consumed and/or used either as beverage or medicine. It comes from plant that underwent the process of fermentation. When taken, alcohol changes a person's physical and mental state. It also brings with it a lot of health risk. Isopropyl, a type of alcohol, a colorless, flammable chemical compound with a strong odor. Together with isopropyl, this type of alcohol are used in laboratories and are poisonous and fatal if taken. Methanol is a non-drinking type of alcohol, also known as wood alcohol and methyl alcohol, which is mostly used to create fuel, solvents, and antifreeze. Ethanol is also called beverage alcohol, which is produced by fermenting fruits and grains. Good day and welcome to Q4 module number 2. In this module, we are going to discuss the different health effects of cigarette smoking. Let us begin. Risk of cigarette smoke. Smokers are more likely than non-smokers to develop heart disease, stroke, and lung cancer. Smokers are at greater risk for diseases that affect the heart and blood vessels, cardiovascular disease. Smoking can cause lung disease by damaging your airways and the small air sacs, alveoli, found in your lungs. Another risks of cigarette smoking. Smokers are more likely than non-smokers to develop heart disease, stroke, and lung cancer. Smokers are at greater risk for diseases that affect the heart and blood vessels, cardiovascular disease. Smoking can cause lung disease by damaging your airways and the small air sacs, alveoli, found in your lungs. Short-term effects. Increased heart rate and increased blood pressure, rarely beneficial to the health in any person. Smoking increases the effect of irritants on any standing allergies, as well as irritating the eyes and nose itself. Another short-term effects are an increase in acid in the stomach, which can be painful. A further effect is bad breath, a direct consequence of each cigarette smoked. If there is short-term, there is also long-term effects. A decrease in fertility. A decrease in the likely birth weight of a baby born to a smoker. An increase in the chances of miscarriages, complications at birth and complications in the baby's development in the womb. A large increase in the chances of developing cervical cancer. Types of smoke. Mainstream smoke that is inhaled into the smoker's mouth and lungs. Inhaling mainstream smoke increases the risk of lung cancer and may increase the risk of other types of cancer. Second-hand smoke. Environmental tobacco smoke, ETS, air that has been contaminated by tobacco smoke. Breathing second-hand smoke interferes with the normal functioning of the heart, blood, and vascular systems in ways that increase the risk of having a heart attack. Even brief exposure to second-hand smoke can damage the lining of blood vessels and cause your blood platelets to become stickier. Third-hand smoke. Residual nicotine and other chemicals left on indoor surfaces by tobacco smoke. People are exposed to these chemicals by touching contaminated surfaces or breathing in the off-gassing from these surfaces. This residue is thought to react with common indoor pollutants to create a toxic mix including cancer-causing compounds, posing a potential health hazard to non-smokers, especially children. Before we go, as part of your assignment, if you know someone smoking, ask him, her why smoke. Ask them if they know the bad effects of it. If they knew the bad effects, why not quit? That's all for today. Thank you and God bless.